who was absolutely fantastic. She again was one of my heroes, which everyone was, but there is ones that are up there. And I really just felt like a connection with her as soon as I saw her. I just don't know what it was. I just felt like, right, she is the surgeon for me, and she was very thorough, and she just lay everything on the table, as it was, the risks involved, everything. I was just fully aware. But and then I thought, right, and for some reason I didn't say yes to the op straight away. I don't know why, but I didn't. And I went back and I had a word with my daughter and my husband. Oh yeah, got to go for it. I just thought I wasn't maybe going to survive it. I don't know. But within a few hours, and then I spoke to Robin. Robin came in, the Macmillan nurse, and I said, right, okay, yes, just bring me sang. I'm definitely going to have it. And then I think after that, Miss Ang wanted me to see my husband as well. So the pair of us went through from the hospital, and my husband came from home. Because bearing in mind, I was in hospital all the way through till I had my operation. So I was in 3 months. I was in hospital 12 weeks at Sunderland Royal, and then I was in 6 nights at the QE. So I think that was probably my treatment, my first lot of treatment. And let's have a look. Yeah, in the occupational health. As soon as they knew I was going to be going back home, they came and sorted a wheelchair out for us. And then I got all the equipment for home. That was all sorted before I left hospital. The physios would then come up. I would walk around the ward to get my strength up, because bearing in mind I'd been lying in bed for a long time, and I'd gone quite weak, because it wasn't really until I'd got solids back in my system that I started to gain like what I would class as my proper strength.
Yeah.
I mean, the TPN obviously kept me alive, but it was the solids I needed to like get my strength back. It was like as if someone had poured boiling water over my stomach. It wasn't a nice feeling, and I was on this drip and I had like this button to press. But I didn't feel as if that made any difference, if I'm totally honest with you. But I'd asked the sister on the ward if I could have some Oromorph and some Zoomorph to take home, because bearing in mind I was in the most horrendous of pain on my tummy. It was, like I said, someone had poured boiling water over us. It was just not a nice feeling. And I was refused. And I was sent home with codeine and paracetamol. And I remember the district nurse coming out the next day, and I spoke to her about it. And she was horrified that I hadn't been given any extra strong painkiller. And she rang the GP surgery for me when she was in the house to ask for a prescription for me.
I don't think anything could have been done any better, because they were really good. I was talking to Macmillan as well, and they were really, really good. But the treatment was really good as well. Obviously, it's a painful recovery.
I guess the difficulty that I had with treatment was that we hit the pandemic. Now, obviously, the situation across the country and the world, and certainly in the NHS, was beyond everybody's control. And the format and the way things were happening was obviously within the guidance that was available at that time. So for example, I was having to go to my treatment on my own, where you would normally have support with that, but that obviously wasn't anything to do with the hospital, the staff, or the NHS as a whole. Really, it was the circumstances of the pandemic. In terms of being in the chemotherapy day unit, the staff, the support when you actually weren't in the unit, being on the other end of the telephone, all of that, I absolutely could not fault. The staff were second to none, and amazing. They do an amazing job. I really couldn't fault it. And again, the surgical team, I would say, I was under Miss Ang at the time, absolutely fantastic. She was really supportive, explained everything really clearly. supported not just myself but my husband and family, and understood where they were, you know, in terms of me having to have significant surgery, that I would be in a theatre for the majority of the day. Absolutely fantastic team. The ward that I was on, again, the staff in there, absolutely amazing, and you know, got me through some difficult moments, but absolutely, again, I couldn't fault.
I went and stayed with my parents who live in the borders of Scotland. So having to come down to get my COVID swabs before any operation or any time I go in the hospital, it was like a 2-hour journey there, a 2.5-hour journey there and back again. And that was quite hard, especially when I've had like stitches and I've had to go down to the hospital. And again, just being on my own, that was really difficult, not having any support with me whatsoever. Yeah, that wasn't particularly nice. And when I was going through the chemo, my mum and dad were sitting in the car for up to like sometimes 12 hours a day, and there was nowhere for them to go to the toilet because everywhere was shut. This was the time when like McDonald's and all of the restaurants were shut, and my parents couldn't go into the toilet. So that was quite stressful for me because I'm going through the chemo, but I'm also worrying about my mum and dad as well. And I just felt like there was no compassion from some hospitals. And it was just, well, it's COVID. Yeah, but this is like a different set of circumstances. It's not like we live here. We don't live close. So that was really difficult. And then again, just waiting, because my mum and dad's doctor's surgeries in Scotland, quite often there was a delay in getting my bloods back. So when I would turn up for chemo, I would ring them and ask if they've got my bloods, but they'd be like, oh, we can't, like, until you get here. So quite often when I'd get there, my bloods weren't ready, so I'd have to get my bloods taken again, and that obviously adds on time onto the day. But they were friendly. Everyone was lovely and friendly. I just find it very triggering to go back there. Just, it's not a very nice place to go. When I went through my operations, I can't fault the surgeons whatsoever. They were brilliant, coming and checking on me, making sure that I was okay, and just checking in and looking. Obviously, I know, doing their job and looking at my scars and everything. But I felt like they had like a vested interest. They were wanting to be there for me. Just the way that they spoke to me, just when I literally come out of an operation and they were asking me what I wanted for tea, and I was like, I just don't fancy anything. And then to just be really sharp and snotty with me was just disgusting, really, and it made me not want to ask for anything. So there was days where I literally didn't eat anything until the evening because I just didn't want the aggro off them, because I felt like I was a burden. But it was only 2 out of the whole time. Like, everybody else was lovely.
Actually, I found my treatment phase really quick and efficient, apart from one instance. I mean, the sort of finding out I had cancer in the August, and then in the September I ended up in hospital having my ascites taken off me, my fluid taken off me, which was a really quick quick thing that happened, and it really went very well. I then started chemo, but there was a little bit of a falter at the beginning of my chemo because I was allergic to one of the chemos they were giving me, and it meant instead of just stop it, well, they stopped obviously the chemo I was allergic to, but instead of that day still giving me the other chemo treatment, they just didn't give me any. And then sort of a couple of weeks later, I saw my oncologist, and he wasn't very happy that they hadn't given me the other chemo. I mean, I've got nothing but praise for the ward I was on at the QE, ward 22, I think it was, at the Jubilee wing. The girls on there, everybody on there were fabulous, absolutely fabulous, you know.
It's a bit of a trek going through every 3 weeks because I don't drive, so I've got to have my daughter. One of my daughters takes us to, we take turns, but I couldn't fight the treatment. I mean, the nurses were absolutely brilliant, and they're all a laugh a minute. Honestly, there's one goes around, I think it's Emily Paula, and she purposely sings off too, just to make you laugh. And everybody is so friendly, and nothing's a bother for them. It's like, you need mouthwash, you need moisturiser, is there anything else we can do for you? And when I went for my pre-assessment, that was the only time I cried after being informed I had cancer, because I was told I would have to go into ICU, which was a bit frightening, but like, you know, it's for people that's near death's door as far as I'm concerned. The treatment I got at the QE while I was in hospital was absolutely brilliant. I couldn't fault even the clinic. Treatment there was only about half an hour to 3/4 of an hour. And it's a half-hour drive through, so it's not worth them leaving to come home. And they have to sit in the car. And that's the only thing I can say. And I know it's not the QE's fault. People have to, you know, they drove you there, have to wait in the cars.
Do you know, the whole experience was like a roller coaster. You were like, oh, and then you felt as if you were going somewhere that something else happened. And so the operation was fine, nurses were fine, consultant was brilliant. I think she was definitely my saviour. And I think in hospital, they've got a tendency to give you the worst scenario, which I didn't mind that, because then everything else is a bit of a bonus, isn't it? Because I remember measuring up for a bag, because I needed a bag, but I didn't. So that's good in a way, you know, that you like expect the worst and everything else is a bonus when you wake up. So when I woke up, she was really pleased. She said she looked as if she'd getting over cancer. So that was good. So yes, I don't know how you can enjoy your stay in hospital, but it was I knew I had to do it.
Like I say, the nurses at the Freeman, they were absolutely fantastic. They explained everything step by step. So I was there weekly, so that was really good. Obviously, everything was explained, things that could go wrong and things like that. But I felt a bit like I didn't have any support at home, as in, once I got to the QE, they had a nurse, a Macmillan nurse in Sheasterringers, which was really great. But from the Freeman, I felt like I didn't have any support from me Macmillan nurse. It's just the fact that I felt like I had no one professional to talk to, sort of thing, unless I rang her. The surgery went really well. The hospital stay was fantastic. I couldn't have had better care. Yeah, they were absolutely great at the QE.